I'm Bryce Barfus with Summit Dental Care, and today I'd like to talk to you about fractures in teeth, what the causes are, and what can be done about them. The first one is trauma. So there's a lot of times patients will come in from trauma, whether that's bike accidents or car accidents or on the playground. A lot of times people will fracture their teeth just from trauma. The second reason we have fractures in teeth is biting on hard objects. So things like pins. We see some people are biting on fishing line. Some people are stripping wires with their teeth. They're ripping open packages. Some people bite their nails. So all those things cause fractures in the teeth, especially the front teeth with the wear and tear. The third reason we see fractures in teeth is due to tooth decay. If you have a cavity in the tooth, it weakens the tooth structure, and then we see that tooth start to cavitate and start to fracture. And there's certain things that we do to remedy that. The fourth reason we see fractures in teeth is bruxism. That's clenching or grinding the teeth. People have nervous habits or they have anxiety about certain things, and a lot of times at nighttime, sometimes they don't even realize it, they'll start grinding or clenching their teeth at nighttime. So the fifth reason we see fractures in teeth is due to large fillings. You can do small fillings initially and be conservative, but over time, if you do larger and larger fillings, then that compromises the tooth and the tooth becomes weak. And then we can see fractures. A cusp or a part of the tooth can fracture off just from chewing and functioning because it's weakened by the large filling that's there. So when we see these fractures that are due to these reasons that I just listed, there's certain things that we do in the dental office to remedy that and to try to fix that for you. The first way that we remedy that is by dental bonding. We use composite material as tooth-colored filling. It's not silver fillings. A lot of times patients will ask, well, do you do silver fillings? Do you do tooth-colored fillings? We've always done tooth-colored fillings, and so we do dental bonding. If it's small enough, if it's confined to a third of the tooth, then what we'll do is bond some composite in there to make it look and act like natural tooth structure. The second thing that we'll do to remedy tooth fractures, if it's large enough, our rule of thumb is if it's larger than half the tooth, or larger than 3/4 of the tooth, then we need to do a crown, a dental crown. And what that is we reduce the tooth structure on top and around the tooth, and it fits over just like a hat. So it goes over the entire tooth and it helps to protect it. It's a restoration that lasts a long time, has a longevity and looks natural like a natural tooth does. The third thing that sometimes we have to do with fractures is if the fracture goes into the inside of the tooth, the nerve, or the blood supply of the tooth, then we have to do what's called a root canal therapy. Now, root canals get a bad name from just in the past, but root canals really aren't that scary. What we have to do is go inside the tooth, take out the nerve and the blood supply, disinfect the canal system, and then we put a filler material in there, and then we protect it with a crown over the top. So if it's severe enough, but the tooth can be saved, we do a root canal therapy and then we do a crown. It preserves the tooth and preserves the function of your natural tooth. The fourth thing that sometimes we have to do with fractures is if the tooth fractures enough and there's enough tooth structure missing and we can't restore the tooth, then we have to take the tooth out. If we take the tooth out, then we have remedies or solutions to fill that gap. And some of those solutions is one, we can do an implant. That's the best solution if we have one missing tooth. If we have multiple missing teeth, we can do implants, or we can do a bridge going across from a tooth to a tooth to anchor in. That's something that stays in there permanently. If you have multiple missing teeth, we can do dentures, or we can do a combination of implants and dentures to replace the missing teeth. So there's always options, there's always solutions that we can talk about and discuss if you have missing teeth and you need those teeth restored. So it's crucial that you go and see your dentist if you suspect that you have a fracture in your tooth. There's some signs and symptoms to look for in fractured teeth. Some of the signs is obviously you see a fractured tooth, you need to go get that taken care of at the dentist. Some symptoms that we can talk about are if you're biting down and you have some severe pressure that you have as you're biting down, or you have some swelling or an abscess that's starting to form, then that's when you need to go visit your dentist as soon as possible. Whether it's small or whether it's large, it's important that you go and see your dental professional, and they can either do some bonding, or they can do a crown or root canal therapy, or possibly an implant to remedy that fractured tooth that you have. If you have a fractured tooth, we're here to help you here at Summit Dental Care. Give us a call.